Do you have any tips on a frozen shoulder?
One of the things with the frozen shoulder is everybody wants to blame where it hurts, but the problem is with the frozen shoulder, the dysfunction is actually happening from the shoulder blade. And I know a lot of people too are blaming their hormones and things like that. There's no reason for it to get inflamed unless there's some kind of dysfunction that's taking place. Usually the problem is in the shoulder blade, and then you start moving it and you can't clear space for all the tissues underneath the shoulder blade to be able to move freely. And that can be the rotator cuff tendon, the subacromial bursa, the bicep tendon, and then it just starts to get pinched, starts to get really, really inflamed. Then it hurts, then you stop moving it, and then all of a sudden, boom, you get all the scar tissue into that area. The place where that you start is that you have to start getting function back and good movement back within the shoulder blade. And this is why we have a lot of people come in, they have a frozen shoulder, and we'll do things like rapid release in order to start breaking up the adhesions and the scar tissue, but then also start moving the shoulder, but then start rehabbing and start getting proper motion back into the shoulder blade. This is why things like crossover symmetry, once you get motion back, can be so important to prevent it from coming back.
Thank you.
Yep.